Welcome to the Explainer. Now, if you work anywhere near the medical field, you already know the open secret, right? The actual life-saving practice of healthcare is constantly buried under this crushing, incredibly complex mountain of administrative paperwork, compliance checklists, and reporting. It's a slow, agonizing reality, and honestly, it burns out brilliant professionals every single day. But what if we could change that? 70%. Just let that massive metric sink in for a second. The revolutionary AI platform we're analyzing today, MediAI, has been designed and actually proven to completely eliminate 70% of a hospital's administrative workload. It totally forces us to rethink how a medical facility operates. Just imagine, what if every single role in a hospital, from the CEO at the very top, all the way down to frontline nurses, the IT department, and even the dietetics team, what if they all had their own genius-level AI assistant? We are talking about deploying a unified task exchange that literally rewires medical administration from the ground up. Okay, let's dive right into this and map out the incredible ripple effect this platform creates. We'll start with the administration crisis, then meet the MediAI brain, look at the role assistance, explore the clinical precision, check out the exponential ROI, and finally see how it scales the ecosystem. All right, part one, the healthcare administration crisis. Look, we've got to face facts. The sluggish, expensive reality of traditional medical documentation creates dangerous bottlenecks. It frustrates staff, and inevitably, it delays patient care. But compare the old manual way to the MediAI way. Prepping documentation for national accreditation standards like NABH, that usually takes a grueling 3 months. Well, MediAI cuts that down to just 2 weeks. Or what about generating a comprehensive patient discharge summary? That drops from an average of 30 minutes of tedious typing down to just 30 seconds. Turning a half-hour task into a 30-second task across hundreds of patients per week, that completely changes the operational game. Moving on to part two, meet the MediAI brain. So, you're probably wondering, how is this unprecedented level of speed and intelligence even possible? It all comes down to this brilliant hub-and-spoke architecture. The MediAI brain sits right in the center as the intelligence hub, connecting over 13 distinct hospital departments. Instead of forcing a hospital to buy, fragmented, disconnected software for every single team, you get one single AI brain. And it intelligently routes, understands, and tailors its support to everyone, from biomedical engineering all the way to the front office. Which brings us perfectly to part three, an assistant for every role. Let's start on the clinical side. Doctors and consultants get a highly customized experience, and so does nursing administration. Notice how the AI gives them distinct, role-specific quick actions. For the doctors, it's all about drafting instant clinical differential diagnoses and bringing up detailed anatomy diagrams. But for nurses, it's instantly generating shift rosters and complex clinical handover templates, like the SBR format. The platform actually natively understands the specific terminology and needs of each distinct medical domain. But the magic doesn't stop at the clinic door. Switching over to the operational side, the exact same centralized brain empowers the IT department to instantly generate comprehensive security audits and incident reports. Meanwhile, finance can run complex budget forecasts, tax reports, and ROI analyses. It is a totally unified experience across the entire organization. And behind all these sleek interfaces are real hardworking people finally getting their time back. Just listen to this incredibly powerful real-world testimony from a chief nursing officer at a 300-bed hospital. We reduced our documentation time by 80%. The nursing care plans alone saved us 15 hours per week. Let that sink in. The big takeaway here? That is 15 hours a week given right back to frontline healthcare workers, allowing them to focus on actual human patient care instead of just staring at computer screens. All right, part four, high-stakes clinical precision. Now, we know that in healthcare, you cannot simply slap a basic consumer chatbot onto a hospital network and cross your fingers, right? Administrators demand and absolutely need strict trust, security, and regulatory compliance. That is exactly why MediAI uses an enterprise-grade foundation. The whole thing is powered by Anthropic's Claude AI, specifically chosen for its advanced reasoning capabilities. The security is completely rock solid. We're talking SQLite encrypted databases, strict role-based access control, and even offline capabilities. Crucially, every output is designed to be strictly compliant with national healthcare standards like NAAB, AERB, and NABL. This is serious, heavily secured infrastructure. Which leads us to part five, exponential ROI and impact. When you save this much time across this many departments, that administrative ripple effect translates into undeniable financial returns. Let's look at a standard 200-bed hospital as our baseline. Their monthly cost on the professional plan is just $499. But the average monetary value of all that time saved by the medical and admin staff, that equates to $12,000. That leaves a net monthly benefit of over $11,500. We are literally talking about a 2,300% annual return on investment. The financial logic for adopting this is just crystal clear. And management isn't just flying blind while all this massive efficiency happens behind the scenes. Leadership gets a centralized control and operational analytics dashboard that gives them deep, real-time tracking. They can monitor active users, keep an eye on automated token logging, view revenue metrics, and track overall efficiency across every single connected department. Total visibility into the hospital's operations. Finally, let's wrap up with part 6, scaling the healthcare ecosystem. Here's where it gets even more exciting. MediAI isn't just a powerful tool for individual hospitals, it is brilliantly structured as a scalable business opportunity for tech entrepreneurs and platform owners. It functions as a scalable revenue engine. If you're a platform owner, you can actually deploy custom white-labeled instances of MediAI. You apply specific hospital branding directly to the web-based system without any complex, messy installations. And the best part? It operates with absolutely zero operational overhead, fully automated billing, and an automatic 30% owner commission that's calculated and tracked on all subscriptions. It is almost unbelievable how frictionless it is to launch and scale this SaaS business. The deployment process is demystified into literally 4 easy steps. Number 1, a simple one-click deployment. Number 2, configure your commission rates. Number 3, add hospitals instantly via your admin dashboard. And number 4, earn scalable, recurring revenue. This setup allows owners to easily manage 20-plus hospitals without breaking a sweat. So that leaves us with one final, pretty provocative question to chew on. Are you ready to become the central nervous system of modern healthcare? Look, whether you are a healthcare professional desperate to finally end administrative burnout or an entrepreneur looking to scale a massive, high-margin SaaS solution, this technology changes everything. The one thing we know for sure, the old, agonizingly slow way of doing things is officially obsolete. Thank you so much for diving into this explainer with me, and definitely keep questioning how we can build better systems.